blanket protocol for all babies. I cannot believe a medical professional is saying the warning label doesn't matter. Wow, eat the Tide Pods then, per the recommendations of this guy who says warning labels and side effects don't matter. So first of all, please don't eat any Tide Pods. I never said that. What I actually said was there are no studies that demonstrate any negative side effects from vitamin K. There are not. There is only one reported case of a baby that had a vitamin K related anaphylactic reaction, and the baby did fine. On top of that, everybody kept bringing up the black box warning, but the black box warning is for adult dosage in adults who are in a traumatic situation that necessitates getting vitamin K, which is completely different from giving it to a newborn baby. So everybody that kept screaming about vitamin K in newborn babies was talking about a black box warning that didn't apply to the babies. And despite having to explain that multiple times, no one was getting it. What happens when you don't ask questions? So I'm Dr. Rahi Victory, a reproductive endocrinology and fertility specialist, and we're going to talk about what happens when you don't know what's going on and don't ask the questions, and also don't advocate for yourself. When you're going through fertility, most people have no clue what's going on. They're at the fertility office or doctor in order to find out what's wrong. So number one, you deserve answers. There's going to be testing, and then there's going to be results. And if you're not getting those results explained to you in language that you can understand, then you won't understand what's going on. No matter how good a job we do helping you get pregnant, if you go through the process without knowing what's happening, I guarantee you it's going to have some degree of trauma, emotional, mental, or financial, because you didn't know what the steps were, why they were happening, when they were happening, how they were happening. So it's really important for you to understand exactly what is wrong with you. How do you do that? You got to ask. Should you have to ask? No. In a good fertility office or clinic, the doctors will know enough to advise you on every single thing that's going on with you. Here at Victory Reproductive Care, when we get your tests, I literally read them out to you line by line, explain what each and every single test means. You need that level of care. Why? Because like I said, if you don't get that level of care, you're walking away confused, frustrated, possibly annoyed, and definitely anxious because you don't understand what is going on. The other part is that when it comes to treatments, you need options. No one should be told this is the only thing you can do, because there's always options. Options might be as simple as no therapy or IVF, or it might be no therapy, IUI, IVF, and surgery. There's loads of options available, but there's never just one option. So make sure that you are asking for options. If they're not giving you option, you got to be wondering what the motivation behind not getting any options is, because there is always an option available to you, and you've got to be able to consider the risks, the benefits, and the costs of each and every option. If you don't, you're not really getting appropriate care, are you? You're not understanding, again, what your choices are. You don't understand the risks and benefits of them. More frustration, more stress, and probably a lot more cost than you needed to go through. So make sure you understand what your options are. And then finally, make sure they're going through what the outcomes are going to be. It's great to tell someone that you think as the doctor, I can get you pregnant with one cycle of IVF. This is going to be a slam dunk, no problem. But if you also don't explain to the patient that that slam dunk actually means they've got a 65% chance of walking away with the baby, when they're not successful, they're going to be saying, wait a minute, you said this was a slam dunk. And it's kind of late at that point to say, well, I actually meant you had a 65% chance. So advocate for yourself. Ask specifics. How high are my chances? Exactly what are my outcomes going to be? How long is this going to take? How many tries am I going to have to put into this? How much is this all going to cost? All of these things are really critical for you to understand. There's a brilliant Israeli study where they brought women in who were admittedly a little bit older in their reproductive age, and they sat them down and they told them, you have a 5% chance of success. And as the women exited the clinic, they had them sit down and fill out a form, and one of the questions was, how high do you think your chances of success are? And the average was 49.3%.
So even though they were told it's 5%, they were walking out thinking it was 10 times that level. So it's really important for you to advocate for yourselves, because even when we say it to you in the clinic, it doesn't always register on the first try. We have to do an amazing job of educating you, of informing you, so that you can make a decision that is right for you. Never accept cookie cutter medicine. We're not baking cookies, we're making babies here.
Hi, I'm Dr. Rahi Victory, and today we are going to talk about the top 5 vitamins or supplements that you can use to improve your fertility. So, for the vitamins that you can use to improve your fertility, if we're talking about getting pregnant using IVF, and we're talking about a patient that does not have endometriosis or something significant like polycystic ovarian syndrome, here are the basic ones you can use to improve your outcomes. Number 1, vitamin D. Studies are very clear that vitamin D has an enormous impact on your success in getting pregnant. The more vitamin D that you have, that's closer to the normal range, you don't want to go over in excess, the better your outcomes are going to be in terms of successfully conceiving and also in terms of reducing miscarriage. As recently as a couple of weeks ago, a study was released demonstrating that patients with low vitamin D have a higher rate of miscarriage. So simply correcting your vitamin D levels is very important. It's an easy test to have done. They can test it in your blood, and there are multiple formulations of vitamin D which can be taken to improve your success. Number 2, you need a good prenatal. Check out our video with the link right here called The Good, the Bad, and the Prenatal, where we compared several different brands and the contents of each brand. So there are lots of different prenatals. You can check those out, but you definitely want one that has as many and as much of each of the daily recommended vitamins as possible. There are numerous different formulations. Find one that's right for you and that settles with your stomach well as well, because that's also an important part. Number 3, fish oils. There's more and more evidence coming up all the time that the fish oils, also known as omega-3 fatty acids, can be particularly useful in quelling or decreasing inflammation in your body. The less inflammation you have, the higher the chances you're going to get pregnant and stay pregnant. More and more studies are coming out suggesting that these can be very important in terms of your success. Number 4, melatonin. Something that most people don't know about, but melatonin during stimulation for a frozen embryo transfer will have a very significant increase in your chances of success, usually up as high as 30% more than the patients that did not take the melatonin. We're not quite sure if it's because it helps you sleep better, and we know that sleep's really important for your IVF, but at the end of the day, we do know that patients that took the melatonin did better. It has absolutely no side effects, and for you, that's going to be a good thing to help improve your success rates with no compromise to you. And lastly, iron. There are studies coming out now that suggest that women that have low levels of iron will have a decrease in their success rate. By taking iron, you'll improve your success rates and potentially reduce your chances of miscarriage. And it's also really important once you're pregnant, because your baby or babies are going to be very, very effective at sucking up all the iron that you have in you. And then if you're depleted, you'll start feeling tired, fatigued, and very kind of slow and lethargic, and it makes it for a much more challenging pregnancy. So by keeping your iron levels high from the beginning, you're going to help yourself not just get pregnant, but have a more comfortable pregnancy. The other medications that we talk about but aren't quite supplements are aspirin. Aspirin can be very useful, and progesterone as well. So those are things you need to talk to your fertility specialist about, but are easy to take, relatively easy to find, and have very few side effects if taken appropriately. Make sure you click that subscribe button if you want to learn more about fertility, and comment to us about what vitamins you're taking and how they settled with you and your fertility journey. I was watching Curb Your Enthusiasm the other day, and I noticed Larry talking to a pregnant woman and being quite antagonistic about the fact that she is running on a treadmill. You can see it right there next to me, a little clip running.
What are you doing?
What?
What's with the jogging?
I'm working out.
Working out?
Yeah.
You're jostling the fetus. You can't run in your condition.
Yes, I can. I was advised by my midwife that I should continue to work out.
Maybe you want to consult your blacksmith, see what he has to say about it.
Okay. I don't.
And
wanna get
he's
into it
complaining
with you,
to her,
but,
saying you are jostling the baby. So I thought maybe some people are curious about this and we should address it. So in this particular case, the patient says that her midwife told her that it was fine to run and says it is her baby and her problem. So the question is it safe to quote unquote jostle your baby while you are pregnant? And the answer is your baby is extremely well protected while it is in utero. So you got to remember the baby is surrounded by fluid, then the wall of your uterus, then generally speaking some air gap or bowel or whatever is between the wall of your uterus and your abdominal wall, and then your abdominal wall, which has several layers including muscle, fat, skin, all of which are designed to protect your baby. So
Look at that smile. My man, Dr. V.
are we good now?
Yeah, you're good. But I just fit you in the frame a little bit better.
Yeah, and we need to get TikTok running.
Just a little hairy arminitis.
I love the fact that it's just a wild show all the time. People don't understand just how much goes into making this crazy show.
They have no clue.
It's a lot of work.
There's a lot of work. There's a lot of stress.
Yeah.
Even when you have everything queued up and ready to roll.
Yeah.
Sorry.
You're all good?
Are we live? Are we there? Is everybody watching?
It's all you, man.
Okay, hey, finally, welcome to Fertility Fact and Fiction. I am your host, double board certified reproductive endocrinology and infertility specialist, Dr. Rahi Vikri. And next to me is my friend and currently somewhat slightly panicked social media guy,
Doctor in quotation marks.
Tariq Ibrahim.
Salud.
Salute. So, hi everybody. Hope you had a great week. Good to be back with you all again. Hope you all enjoyed your long weekend. And if you have little kiddies, hopefully you got them off to school okay, without a lot of tears and screaming and forgotten items and stuff. And if you don't have kiddies, we're working on it for you. Not a ton of exciting stuff to talk about quite yet. There is a new addition to DRC,
hopefully very soon, who's going to make a huge difference for us and cut down our wait times. So we're excited about that. We are also working on efficiencies, so we're excited about that. We will be doing some stuff with AI, so we're also excited about that. And I guess we're kind of developing a reputation in the Middle East because I've been doing consults for people in Dubai, Jordan, Saudi Arabia now. So kind of excited. I guess our name's getting out there far and wide and people are coming to us from all over. So hopefully that'll kind of take off. There is actually a group in Saudi Arabia that wants us to work with them. So you never know, we might do something out there as well. And still working on my Irish medical license. So Isabella, if you're watching, please make sure we're working on that. And if you're not watching, you're in trouble because you should be watching. Otherwise, not a lot of new stuff. Anything new with you?
Kids went to school.
Kids went to school.
That's as big as it gets.
Yeah,
that's as big as it gets.
You got a lot of kids, so that's
we smuggled one on the bus today too, to be quite honest. So so they had an IB program.
Yeah.
At some school, but then due to funding, they cut the program. So then there was no point for that school anymore. So then we shipped them back to his previous school. But the funny part is, like, my two kids go on the bus, so obviously the bus is massive, so he can obviously fit on the bus.
Sure.
So I said, go on the bus. He goes on the bus. The bus driver was like, don't see your name on the list. I'm like, yeah, but like, you know, it's pretty obvious the scenario here. Like he's going to that school. Just is the bus full? No, bus not full. All right.
Hop on the bus.
Hop on the bus. So he goes there, no problem. I completely intimidated the bus driver. On the way back, I guess the principal and my son wasn't as intimidating as me, so I had to go and pick him up. Didn't work out exactly how I thought.
Not the way you thought it was gonna go.
Well, what's the big deal?
It's a bus.
It's a bus.
Yeah.
And they got seats. If it's full,
you get it.
I get it. It's empty. The whole school's bloody empty, to be quite honest. So I really didn't comprehend it, but he was super happy because I was driving, you know, so I had a fun time with that. So he felt pretty. At first, when I picked him up, he was very upset. He was super upset. He's like, they didn't let me on the bus. I'm like, don't worry. I got something.
Look what we're in.
Look what we're going in. So he had a good time.
Very, very good. That's exciting stuff. Okay, well, I kind of scoured the internet to find new research for you. There is one study I will probably present next time. And that study is interesting because it is called the Fortune study, Fortune, and it is a study using artificial intelligence models to predict your chances of developing anywhere from 1 to 3 euploid embryos. And using their model and looking at a lot of IVF cycles, it was over 10,000, they actually were able to accurately predict on the kind of polar ends of the extremes your chances of making either 0 euploid embryos or making several euploid embryos based on whether you were very poor prognosis or very good prognosis. And in between, it's kind of less valuable, but on the extremes it was really good, because in the very good prognosis group they had a huge number of patients that were successful in making lots of euploid embryos. And in the very poor, it was actually 100% predictive of making 0 euploid embryos. So that would be really helpful for women who are thinking about doing IVF and don't want to invest a ton of money into it, only to find out that they are not going to be successful. So I think that that's really interesting. The other thing that's been kind of a trend for us recently, and I'm not sure where it's coming from, is we've actually had a lot of women who are in their late 40s, early 50s coming in for fertility. And while I'm more than happy to give anybody a chance, the chances at those ages are remarkably low. And I'm not sure why people aren't being educated enough about this. Maybe we need to do a video on, in fact, you know what, that might be a good long form video, a video on, success rates over the age of 45. But we're not really seeing people coming in with a comprehensive understanding of what their chances are. They're kind of walking in like, hey, what do we have to do to get pregnant? And we're kind of saying, well, like, your chances are negligible. It's really hard at those ages to make it work, no matter what anybody tells you. And so kind of interesting, details about that. So I'm hoping that that'll kind of come out in a video we'll make just to help people understand. If you haven't seen our embryo math video on YouTube, that's a great watch because it really helps you understand what your chances are. And that can really guide you. So I would strongly recommend you go to our YouTube channel, www.youtube.com/drvictory, Dr. Victory. But I think that we need a special one just for women that are sort of in their more advanced reproductive years, because I'm not sure the message is getting out there. And years ago, there was this great study from Israel that showed that when they told women over the age of 43 that they would have a 5% chance of success, and then they left the clinic, and then on the way out of the clinic, they told them to fill out this questionnaire. And in the questionnaire, they said, what do you think your chances of success are? The average was 49.3%. So I don't think patients are necessarily either hearing the right information or getting the right information, but interesting kind of little inflection in our population of patients that we're seeing. And for those of you that are waiting for our in vitro maturation program, we should have exciting news by next show. So I will let you know all the details, and we may even talk about that program next week. So with no further ado, I think we are going to go straight to questions this week, because we always have too many questions anyways, right? Like, we never get through them all.
You have a bunch of questions.
A lot of questions.
You have a bunch of questions.
Yeah. All right. Fire away.
How to measure follicles of women. Let's try this again. Okay.
How to measure follicles.
I'm going to read it.
Okay. And I got to understand it.
Yeah.
Okay.
I'm not going to even try and attempt to assume I know what I'm talking about here.
Okay. Go for it. You got to put it on you. You can't put it on me.
Yeah. Okay. I felt it better for them not to see me read this. How to measure follicles of woman virgins, rectal, abdomen, or vaginal. Is there measurement differences?
Oh, yeah, no. So what she's saying is, if she's virginal, is it better to measure the follicles through her abdomen, vaginal, or transrectal?
Oh, I get it.
So that you don't harm the hymenal ring.
Oh, I see.
Or the hymenal membrane.
Great question.
That's a great question.
We've
never been asked that before. Yeah. So accuracy would probably be highest vaginal. There's no question. But there is the potential, no matter how gentle we are, of disruption of your hymenal membrane. So I don't know that that would be optimal for you. And I would be very reluctant to do that to someone that was virginal, because it would actually probably be uncomfortable. Your next most accurate would probably be rectal, although I must admit I've never done that before. But it would probably be very accurate because you can kind of gently slide the ultrasound probe over, and the rectum has some mobility. So you could probably get very close to the ovary. In fact, in theory, you could probably get closer to the ovary transrectal than you could transvaginal. And then the final option would be transabdominal, which is not very accurate, but is doable and certainly the least invasive. So yeah, we can do that. And that reminds me, one of the long videos we need to make is doing a religiously sensitive IVF cycle, because there are ways to help people who have religious objections to IVF, either because they're worried about the number of eggs or the number of embryos being frozen or freezing any embryos. And we actually have loads of ways we can avoid that. So we'll make you guys a video for that very soon.
Again, super ignorant question on my part. I'm going to introduce it that way. But
Yeah.
why would you want to measure the follicles if you're a virgin?
I don't know. That's a great question.
Oh, it is, right?
Actually, you know, that didn't occur to me
like,
as
why are we even doing it?
processing the whole, where's this ultrasound probe going?
Yeah.
I wasn't thinking, why is this ultrasound probe?
Why are we doing it?
Yeah, I don't know. Why are we doing that? Well, maybe, okay. Cancer patient, still a virgin, needs to do a retrieval.
But do you need to measure the follicles? Or you just take them out?
No, you got to do it.
You always got to measure.
You got to stim, and then you got to retrieve.
You always got to do that.
Yeah. And then I guess we'd have to potentially do a transabdominal retrieval for that patient if she wasn't willing to let us go transvaginal. So that would be complicated for sure. Yeah.
So here's the scenario.
Yeah. Ask her. Maybe give us some details. That would be interesting.
I have to keep scrolling up and down to make sure I don't miss it. Okay. Next question.
Yeah.
Good number for IUI. Double ejaculation, 33 million before wash, 12 million after zymotes.
Yeah, that's pretty reasonable. I mean, Zymet really cuts down the number of sperm because only good sperm can get through the microporous filters from any microfluidic device. And Zyma is like the original, but there's other ones. So because of that, you see way less sperm on the other side. So Zyma, you're definitely going to get a low count, but 12 million after a Zymet wash, that's actually pretty decent, I would say. We know from studies that you need between 9 to 14 million good quality live moving sperm to do a decent IUI. So if you're at 12 million, you're already pretty good after a Zymet wash.
Hi, Dr. V and Dr. T. Is letrozole ever used to prime for an egg retrieval? What dose, when, and for how long?
Yeah, so we did it for quite some time. And what we found was we were getting a lot of immature eggs. So I spoke to some of my colleagues and they all said, wait an extra day, but then waiting an extra day tends to compromise egg quality. So we abandoned it because I just couldn't see it helping us very much. So we don't use it anymore. I might go back to trying it again on an experimental basis, but I don't know. I'm kind of hesitant to do it right now. So we'll have to see how things pan out. But at the moment, we don't use it. If you are going to use it, most people just use 5 milligrams a day from day 3 to 7 or 2 to 6. If you're using it as part of a breast cancer protocol, you go on it and you stay on it the whole time to keep your estrogen levels low. So that's a different protocol. And we have done that before, but we don't do it with our normal stims.
Dr. V, why do you not advise doing 300 IUs of Menopur? And what are your thoughts on mixing out with 150 milligrams of Clomid a day since I'm not able to do egg in a cycle?
Well, that has nothing to do with an agonist cycle. But Menopur is intentionally contaminated with HCG. And because it's intentionally contaminated with HCG, you need to be aware of the fact that you will end up with fewer eggs because HCG retards the growth of small follicles. So as a result of that, you'll end up with fewer follicles and some of the smaller follicles not growing as much. That's not a good idea. So while I strongly support Menopur as a drug, it's a fantastic drug. It has beneficial effects on egg quality. Too much of it is not a good thing. And so we max out at 150. We even tried 187.5 and I even backed off of that. We just max out at 150. At that level, you're getting, I think, 26 units of HCG per day, and that's more than enough. Above that, you probably are having some detrimental effect on the eggs. And that's just my own personal opinion. I don't have scientific data to back that up. So I want that to be very clear, but it physiologically and pharmacokinetically makes sense.
Doctors, what is the risk of fetal placenta issues with a slightly elevated AFP? My mom at 18, 19 weeks was 2.56, cut off 2.5. NIPT was clear. My 20-week ultrasound is next week, and I'm freaking out.
At 2.56, I wouldn't be worried at all. But we would actually look more for neural tube defects and cardiac defects before we would be looking at placental defects. It's not a great predictor for placental defects. Yeah.
Dr. T and V.
You go first. Yeah, you're liking that.
I guess me first. Is there anything I can do, anything an endometriosis patient can do to prevent ovarian cysts? I think you said you wouldn't use birth control and DHEA, and sirolimus didn't help.
I'm not sure what you're referring to. Birth control will help you prevent cysts. We know that birth control helps prevent cysts. Is it going to prevent endometriomas? No. But is it going to prevent cysts? Yes. Is there anything that can prevent endometriomas? Keep your stims low. That's basically about it. There's nothing really else you could do. So I'm not quite sure what you're asking, but hopefully that answers your question.
If you're doing a hysteroscopy surgery to remove polyps, would you be able to see anything else, adeno or anything else during this procedure?
Adenomyosis is in the wall of the uterus. If you can see adenomyosis during a hysteroscopy, you have gone horribly, horribly, horribly wrong and entered into the wall of the uterus, which makes you a really bad surgeon. So please don't do that. So no, you cannot see that. Adenomyosis is an ultrasonographic or MRI finding or biopsy of the wall of the uterus, which nobody does or should do. So no, you can't see it any other way.
Dr. V, what are your thoughts on ICSI and PICSI? My doctor wants me to do PICSI because of my partner's low sperm count, motility, and DNA fragmentation.
Well, I'm a big believer in ICSI. We do it for all our patients. PICSI, I'm not convinced by the data. The data does not support a significant benefit to it. So I don't believe in it, but we have other sperm selection techniques here that I think are stronger and better. So that's what we're using.
Hi, Dr. T. And Dr. V.
I knew there was something coming because
Yeah,
he was grinning. Yeah.
Is it safe to take allergy and or cold medicine while on sirolimus?
Well, I think the bigger question to ask is, should you get off of sirolimus while you have a cold? And the answer would probably be yes. So I'm going to answer that in reverse. Is it safe to take allergy meds? It should be. I can't see why allergy meds would interact, but you'd have to talk to a pharmacist. I am not a pharmacist, but I don't know why you'd stay on it while you have a cold, because we're not going to go ahead with a stim or a transfer.
Thin lining sufferer here.
Oh, yeah.
Okay.
We got a video coming.
Introducing it.
Yeah. Yeah.
How much does a 6.5 to 7 millimeter lining actually impact pregnancy rates? I'm so stressed moving forward with it, but it's literally impossible to get to 8 millimeters.
Studies show that there is a significant decrease. Depends on which study you look at, but most will say like 20 to 30% less once you're under 7 millimeters. So there is a significant decrease. Now, keep in mind, if your success rate normally is, let's say, 70%, and you drop that down by 20 to 30, you're still in the 50s. So that's not necessarily, or even 60s, that's not necessarily a bad success rate. So it doesn't mean it's not going to work. It just means your clinic has to have really good success rates to begin with. We always want to optimize your endometrial thickness, but I have patients where I can't thicken their lining. I mean, we've tried everything. I just spoke to 2 last week. So yeah, I mean, in those cases, we do everything we possibly can.
So right now, I reached a point in the comments, at least from an Instagram perspective, that they're saying, what happened to the video?
What happened to?
Well, you know, when we started,
way back in the beginning. Oh, yeah.
This is where I am right now. So just so everybody knows, this is the pace that we go in. There are a lot of questions being asked. So just so everyone knows. But again, if you ever want your question to be asked, There are workarounds. So if you know, you know.
All right.
What are some other options besides Fertility? They do not ship to Newfoundland.
How can they not ship to Newfoundland? I can probably ship you a kit from us to Newfoundland, and then you can ship it back to Fertility. I don't have response for microbiome in Canada because currently there isn't an alternative. There will be soon because we're developing one. So hopefully within a month or two, we'll have our own sort of kit. If you're talking just the immunological testing, there's a bunch of options. Braverman Labs, Alan Beers Labs, Rosalind Franklin University. Like there's lots of different options for you.
Like and share the video feed on all the platforms.
Oh, yes. Please like and share the video feed on all the platforms. Yeah. Yeah. And thank you to all of you who have been phenomenal about liking and sharing content on our Instagram posts. We've had huge numbers of views. So please continue to share. Huge apology, by the way, to at Lauren Osco, who is a spectacularly talented young lady. I saw a post of hers where she showed that she was pregnant. And what I didn't realize was that she had subsequently miscarried. So my apologies. And I did apologize to her in person. So I popped up a story saying she was pregnant. And then I quickly took it down because someone told me she wasn't. So Ms. Osco, I am very, very sorry for that inappropriate post. My humble apologies. It was completely unintentional. And if you ever have a chance to watch our show, I will happily help you out as an apology. So please let me know if I can be of service to you, because I would love to make your dreams come true. And you certainly deserve that. Huge shout out to the Pissinis, who recently also found out they're pregnant, for those of you that follow them. And so, yeah, there's a lot of interesting stuff going on in the social media world. To all those people who are screaming at me to be their physician slave on paging Dr. Fran, I will never be a physician slave. I literally have women telling me I must do what they tell me to. No, I don't have to do what you tell me to. I actually am an individual with my own social, moral, ethical, philosophical values and religious values, and I do not need to do what any patient tells me to. I am obligated to provide you with access to care, which I always do, but I have no obligation to perform something I don't believe in. So yeah, I don't know where
That's still happening.
Oh, every day. This one lady for the last week will not relent. And she keeps telling me that I'm forcing women to have babies. I'm like, I literally teach contraception. Like, how do you think that I am forcing women to have babies? I'm not telling anyone to have babies. I'm telling them not to have permanent sterilization when they're 25. She's like, you're imposing your will. I'm like, how am I imposing my will? If they want it, I'll send them to another doctor. I just won't do it myself. She will not relent. Just keeps hitting me every day. So finally this evening I said, like, can we please end this? Because you're not going to convince me, because you're wrong in my opinion. And she won't give up.
She won't stop.
No, she's like, you can't be a doctor. You don't understand what I'm trying to argue with you. I'm like, no, actually, you don't understand that what you're arguing with me is wrong. She won't let up. Just keeps hammering away at me day after day. I'm like, wow. I don't think you're catching on to the fact that this isn't going in your direction anytime soon. But anyways, yeah, I'm not going to do that. Same thing for the vitamin K people. The amount of misinformation on vitamin K, just wow. People coming out with all crazy stories. My absolute favorite is this concept that God decided that babies should be born with low vitamin K because that somehow magically helps transport stem cells that are present in the umbilical cord, which is true, through the baby's body to heal the baby. So I would like to ask all those lunatics that believe in that, A, where's the evidence for that? Because that's absolutely not true. There's zero evidence for that whatsoever at all. And B, more importantly, if that were true, then babies who have delayed cord clamping would magically have better outcomes than babies that don't get delayed cord clamping. You know what the difference is between babies that get delayed cord clamping and non? An increase in iron, That's it. There is literally no other differences. And for those babies that have been injured from their birth, so something like intrapartum fetal asphyxia, if this whole stem cell theory was true, then those babies would actually do better with delayed cord clamping than the babies that do not have delayed cord clamping. In reality, what's actually happening, yeah, if you delay cord clamping on a baby with intrapartum fetal asphyxia and fetal acidosis, those babies are going to have an even higher risk of trauma and damage. So the idea that the stem cells are running around healing them is just blatant, absolute gibberish nonsense. So I'm going to say this again because I've said it before. For all those of you that think that vitamin K is harmful because of the infinitesimally small environmental contamination of aluminum, the benzyl alcohol, which has been proven to be harmless, the polysorbate 80, which has also been proven to be harmless and is in freaking ice cream, or any other aspect of vitamin K, including the black box warning, which only applies to adults in trauma situations, please, for the love of God, stop endangering babies, stop spreading misinformation, and stop telling people that the oral version is better. They tried it in the Netherlands. The rates of VKDB went up. So they went back to recommending shots because they realized the oral doesn't work as well. So stop talking about stem cells and making up fantasy ideas. You're not doctors. You're not even scientists. You're not trained, and you don't actually understand any part of this, as demonstrated by the fantastical theory of stem cells and God's wish that they traverse the baby's body. Like, just come on, people. Give up on the fantasy nonsense. You're not getting the right story. And here's my favorite thing. Everybody's telling us as doctors that big pharma has blocked our ability to think clearly, but you're literally swallowing propaganda hook, line, and sinker every time. And then you're accusing us of not being free thinking. You're the ones that are being blinded, not us. We actually study the science and follow where it takes us. You actually are following dogma, propaganda, nonsense, lies. Don't do that. It's a waste of time, and you're harming babies. Harming babies.
My favorite is when you'll find this guy on YouTube or girl on YouTube or anyone on YouTube or TikTok or whatever doing a quick video and saying, this is so dangerous for you, da, 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 da. And then miraculously, they happen to have a Amazon shop page and they're selling it.
Every time, right? Like, don't do this. Don't do these 4 things because they're all terrible for your fertility. But here's the one thing that will help. And then it's like, buy this supplement, and they're selling the supplement or get a kickback for it, right? Like, I don't sell supplements, and I have no relationship with a pharma company to, promote one product or another, which is why on the show we always say, I don't promote one pharma company over another for anything, not for vitamins, not for drugs, nothing. We just don't do that. A, it's illegal in Canada, and B, I wouldn't do it even if it was legal. I'm not working for pharma. Our show isn't sponsored by pharma. We don't get advertising revenue. We don't do any of that stuff.
I have a great question for you.
Fire.
And when I say great question,
kind of riled up from that.
I let you do your thing. You were doing fantastic. So here's the question.
Yeah.
And prepare yourself.
Okay.
This question
Do
for
I need
sure,
a pen?
No, it's
Okay.
short.
Okay.
But this question has never been asked on the show.
Oh, okay.
Ever.
Great. All right.
Not even a degree of it.
Yeah.
I don't even know if you know it. It's a good one.
It's a challenge.
It's a challenge.
All right. I'm up. Let's go.
I always have lactation.
Okay.
Even though my prolactin level are MRI clear, what could it be? No kids, 1 miscarriage. I've tried 2 meds, nothing will dry it up. My endocrinologist literally told me he didn't want to see me again because he has no idea.
Well, first of all, you mentioned MRI, but I would want to know your prolactin levels. So I would need to know what they are. Second of all, I would probably want to see a breast ultrasound to make sure that it's not actually a cyst or something that's producing fluid, which would be the next go-to. Because if you're failing something like Dostanex or bromocriptine, then there is no question that there is something else going on other than lactation. It's probably fluid coming out of the breast, and that's most commonly going to be from a cyst or a glandular problem. They can do a ductogram where they flush in dye and see where it goes. So you might just have a cyst in there somewhere. So yeah, there's ways to figure that out.
You know what? I'll be honest with you. I read it. It sounded super complicated. You answered it. No big deal.
No big deal.
Next time somebody tells me they have this problem,
you'll know what to
I know
say.
what to say.
Yeah.
Hi, Dr. Victory. I'm at the clinic tomorrow.
Okay.
Are you in the clinic? I haven't got a chance to meet you in person yet. Hi, doctors. How often does FET get canceled at the final check 2 days before FET? Feeling anxious.
I am not in the clinic tomorrow because I'm operating for the first time in a month after we couldn't get any OR time in August. So I'm helping all my surgical candidates. And I even operated yesterday on some patients that needed it more urgently. With regards to the cancellation, rare 2 days before, like really rare. Yeah, almost never. Something have to be horribly wrong.
Oh, this is also very interesting. Okay. Can you treat for suspected microbiome issues without doing diagnostic testing?
No, because you don't know what you're treating. So I see a lot of patients that find out that they have chronic endometritis on a biopsy, and then they're given like doxycycline, or they're given Flagyl, or they're given a combination. Well, you don't know what you're treating. So as an example, if you have organisms like Staphylococcus or Streptococcus, and they're in the uterus, and you don't appropriately treat those, which require like a penicillin based or maybe a fluoroquinolone, then you're going to miss getting those treated. And as a result of missing getting those treated, what will happen is you'll kill your lactobacillus, which you always do with pretty much any antibiotic. The lacto will die. You'll create an open space for bad bacteria to expand. And because you're not killing the population of bacteria you actually have, you'll not make yourself better. You'll make yourself worse. So these blind attempts at treating microbiome problems are literally idiotic. Like, that makes zero sense. You don't know what you're treating, and you very much could be making yourself much worse than you were before. So I would beg you not to do that. Bad idea.
Is there a specific supplement for endo to prepare for egg retrieval, or more so for transfers?
We focus more on the transfer part of it, but there's no harm to taking the supplements for retrieval. So curcumin, NAC, resveratrol, ALA, and coenzyme Q10. Those are the ones we use, plus your basics: prenatal, melatonin, fish oils, and your vitamin D. Many endo patients also need iron. So those are the basics we would use. Lots of supplements.
Would you please describe day 3 versus day 5 transfer in terms of endometrium prep?
There's no difference in terms of endometrium prep. You just take progesterone for less time. That's the only difference. So yeah, we would not change any part of that. The endometrium prep would be identical. You're just aiming for 3 days of progesterone completed before your day 3 transfer versus 5 days or 6 days before your day 5 or day 6 transfer.
Is PGT available in-house at the clinic yet?
In a couple of weeks. It's ready. We validated. We're just finalizing pricing.
Hi, Dr. V and Dr. T. Big smiley face because they said Dr. T.
Yeah.
It's not a joke, though. It's
a serious thing.
It's
yeah.
like, like when they say Dr. V, is it a joke? You know, like, I'm not getting the emoji. I have high AMH.
Okay.
Dye in the USL regular periods.
Dye in the USL. Oh, deep infiltrating endometriosis in the uterosacral ligament. Okay.
That's why the question's for you. I was reading something, I don't even get it.
Yeah. Okay.
Ovulate on my own.
Yeah.
Great lining.
Yeah.
IVF in November. Which
Yeah.
protocol would you recommend? TTC 2+ years.
Well, your stim protocol probably doesn't make a lot of difference, especially if you have a high AMH. I wouldn't go too high on your doses because that's just going to fry your eggs. It's your transfer protocol that's important. So we have a great video on YouTube. Go on our YouTube video and check that out about our endometriosis protocol, or contact us and we provide you with all the details for it. And then use our endo protocol, because that actually makes a huge difference for people.
Pick me, plus the emoji for this.
That's cute.
Yeah, that's
They
good.
actually said, pick me, pick me.
Pick me, and
All
then
right.
emoji for pick me. Doctor, wanted to do something different.
Okay.
That's how they're starting. They want to do
Okay.
something different.
Yeah.
Triggered on the 19th. I'm not testing. Plus, after going on Friday, is it okay for me to discontinue prog and not do blood HCG Thursday? I'm heartbroken. Thank you, doctors. God bless you. Both amazing.
I don't actually understand that.
Okay, let me try again.
Testing on the 19th. What?
Triggered 19th.
Yeah, triggered the 19th. Okay.
I'm not testing.
I'm not testing.
And after going on Friday, is it okay for me to discontinue the prog and not do blood HCG Thursday?
I'm not sure I understand that question. I'm assuming they already tested this Friday and it was negative after testing on the 19th, which is kind of like borderline early. So no, I would say do another test just to validate, and I wouldn't stop your meds until you have.
Hey, doctors. My RE said an antagonist protocol using 300 IUs of Gonal-F only, no Menopur, with double trigger is better for egg quality. AMH 1.7 nanograms per mil. Thoughts?
Yeah, that's proven untrue. We know that a combination of urinary or at least some LH activity is better than doing just pure recombinant. In fact, Serono actually now apparently has data, which I haven't seen yet, which proves that they get better results when they mix recombinant LH with Gonal-F, Luveris with Gonal-F. So they're coming to meet with us to present that to us. So no, whoever told you that is categorically wrong.
26 weeks, ALT is slightly high at 50.
Oh,
Rest of the labs normal. GI not concerned. Would you be?
yeah. What's your blood pressure doing? Why is your ALT up? Liver ultrasound, cholestasis, preeclampsia, fatty liver disease. Yeah, I'd be very concerned. That's something we would definitely explore with you.
So concerned and not concerned at all is what you're saying.
I'm totally concerned.
You're totally concerned.
I'm very concerned.
And this guy's no big deal.
Well, that's a GI. He's not an OB. Yeah.
What does he know?
I will say, and I think this is important for everybody to hear from me. I am very biased, and I'll admit that I think that it makes a huge difference as a fertility specialist that I still do OB and I still do surgery, because I think you lose a lot of the nuances of being a really good fertility specialist when you're not providing people with obstetrical or surgical care. Number one, you can't offer them all the options, because if you don't operate, how are you going to offer them surgery as an option? And it should be an option in many cases. And from the obstetrical standpoint, there are complications I see that I find other places will ignore. Specifically, complications of obesity, complications of having fatty liver before you get pregnant, all the smoking, the drinking, the drug use. Like, other places don't care. I talked to a guy recently. Wow, this was a significant thing. I talked to someone recently who was drinking way too much alcohol, and the clinic he was working with, which is a well-known clinic in Canada, didn't even acknowledge it. Didn't talk to him about vaping, about alcohol, about marijuana use, nothing. Just like ignored it all. And this guy was like set up for disaster. And they were like, well, why can't we start? And I said, you need to get your sperm clean. Like, it's not going to work with all these substance exposures. He's like, they never told me that at the other place. I was like, well, that's why you didn't get very many embryos when you tried it previously. So, we really want to make sure every single person is optimized. And I think you can only do that when you practice in a kind of holistic setting. Am I going to do OB forever? No, I'm getting old. I don't want to do it forever. But I do think my perspective and years of continuing to do it give me certain advantages over other doctors because they're not doing it. So they're not even thinking in that way. But I'm always thinking about what's best for the patient, not just to get them pregnant, but through their pregnancy. And I think it's just a very different perspective that I'm really blessed to have, but not everybody gets that because they almost universally abandon OB.
Dr. V and Dearest T, what is a good protocol for IUI for 41 years old and 10 months? AMH 1.6, FSH 11.1.
I mean, your best chance is going to be shots. You could use like 3 to 5 units of Recavel or 75 to 112.5 of Gonal-F or Menopur. I would just go for any kind of shot and see how many eggs you make. You'd be reasonable having anywhere from 3 to 4 eggs at that age. So that would be my recommendation. Double trigger, progesterone support, that kind of thing.
Can endometriosis cause low iron?
Yes.
Do you recommend an IV iron?
We recommend IV iron all the time, and I use it frequently, but mostly in our pregnant patients. Pre-fertility treatment or surgery, we do it sometimes when we notice that the patient's ferritin is really low and they're already on oral iron and it's not going up. Can endometriosis cause it? Absolutely. There's well-known associations between endo and low iron.
Here's a low iron question.
Oh boy.
Here we go.
I'm not an iron expert.
I know.
Yeah.
But here's the scenario. Someone has low iron. Is there a way by not eating, let's say, liver or taking liver pills
Yeah.
to just have a good, healthy liver level, ferritin level, and not eating gross tasting food?
Yeah, you just take iron.
Yeah, like let's say you don't want to take the iron supplement.
Oh, green leafy vegetables, spinach, broccoli. Green leafy vegetables have a reasonable amount of iron in them. There's lots of foods that do. Red meat does. You don't have to eat liver.
You don't have to eat liver.
No.
But liver's the best for that.
Liver has a high concentration of iron in it, but you also get a lot of toxins.
Yeah. One of those double-edged
Not
swords.
a great idea. Yeah.
Hi, Dr. V and Tarek. Third round of IVF this month. Curious what you would recommend for my set of circumstances. I'm 42 years old.
Okay.
AMH 1.2.
Okay.
With an 18 millimeter endometrioma.
Oh.
Thanks in advance.
Microdose flare or an antagonist protocol would be options. Medium dose stim. We would combine a recombinant with a urinary. So like a Recavel Menopur, Gonal-F Menopur, or Gonal-F Recavel, although that's not urinary. Sorry, Gonal-F Luveris, although that's not urinary, it's recombinant. Not high dose, lots of supplements, acupuncture, yoga, double trigger, high antioxidant media, blastocyst, PGTA, and then you need an endo protocol for your transfer, assuming you get a genetically normal embryo.
Do you recommend Lupron for FET prep, even if FET is directly after excision surgery?
Yes, 100%. You're never going to get it all. Remember, endometriosis is a disease of endometrial cells outside of the body. You can't see every cell that's there, but they're still active and wreaking havoc, causing the immune system to become inflamed. So you have to do the Lupron to shut all of that off. You can't see all the endo. It's impossible. No one can.
"26 weeks, had 2 episodes when I was sitting kind of hunched over where I got hot, sweaty, and felt like I was going to pass out. Resolved with laying down. Workup was normal. Do you think it's positional?"
Can be. If you're standing too long or lying down on your back, you can get vasovagal. The blood tends to pool or can't go back up to your heart, depending on which of those two positions you're in. So make sure that you are flexing your quad muscles, that you are never flat on your back after 20 weeks. If you're standing too long, flex your quad muscles, and that'll flush the blood back up to your brain and your heart. So that's the easiest way. So kind of as you're standing there, squeeze your quad muscles, not with your hand, but actually flex them so that they're moving. It's kind of like squeezing your buttock. And that'll flex your quad muscles. At least that's how I do it. Yeah.
Thoughts on mini or natural IVF for deep infiltrating endometriosis patients?
Well, listen, you don't want to drive up your estrogen levels too high when you have DIE. So natural and mini stem are reasonable, and I offer them to people. The problem is you also need a lot of embryos, which it's not great for, obviously, because natural you're getting one, and mini you're trying to aim for 2 or 3. So it kind of depends on age, your circumstances, your AMH. Like it has to be individualized. You get someone with a great AMH and they've got endometriosis, you want to make a lot of embryos. So give them a normal stem. Don't do natural or mini. But you get someone with a really low AMH, you're not going to get a better response by pounding them with high doses of drugs. You're going to get poor, and your fertility specialist is going to get rich, but you're not going to succeed. You're actually going to do worse. So it makes sense in those cases to pursue like a mini stem. That's a much better approach to things. I was actually going to ask you about TikTok. I thought you were like abandoning our talkers.
No abandonment.
You got to put it on you. I've been on me for like an hour.
Hello, everybody.
Well,
the problem is reading on TikTok is very difficult. It's quite challenging.
Glasses, dude.
It was good on the computer.
Do you wear glasses?
No. I'm.
I don't think you're.
I see, man. I see. The problem is the table. It's camouflage.
Oh, yeah.
That's what makes it so hard.
Maybe we need to put like a black cloth up here for you.
Yeah, you know what? Not a horrible idea. Just to contrast with the font.
Anti-reflective.
Yeah.
All right.
Is there a specific supplement for endo to prepare for egg retrieval or more so? Did we? Good.
Yeah.
After 2 losses, all under 6 weeks, would it be good to get recurrent loss panel and immunity?
Yes, I would believe so. Yeah. Some would argue for 3, but I think 2 is reasonable.
The video was on me the whole time you answered.
It's all good. Yeah.
Yeah. They heard
we share.
We share. TikTok got it. You know what? Technically speaking, it was a TikTok question. Answered on TikTok. They got you. They got it.
Actually, the TikTokers were still seeing.
They were seeing you the whole time. No harm.
Yeah.
What do you think about metformin and letrozole to conceive for women with PCOS? Thanks.
Great combination, proven to be beneficial synergistically. Definitely something everybody should consider doing. So I would strongly advocate for that.
Is there a reason that a doctor would advise against taking CoQ10 during IVF?
Ignorance. Yeah. Purely ignorance.
This guy's. I read that question and I said to myself, you know what? Remove the DR from this guy. Remove the DR.
Yeah. That's what I get. That's what I get on a regular basis from the people. Oh no.
Oh, that's going to mess it up.
Just shut it off. So that's what I get on a routine basis from people that don't like my posts.
Oh, really?
The vitamin K people, the people that don't like the fact that I won't tie a young woman's tubes. They're like, you need to lose your license. I'm like, would you grow the hell up, for God's sakes? Like, I'm not going to lose my license because you don't like the way I practice.
Would there ever be a scenario where a supplement like CoQ10 would not be recommended in a pregnancy? Like, is there ever a supplement that's like, oh, you know what? This lineup, no good to have these minerals?
There's probably some supplements that would be detrimental if you carried them forward. Some people talk, for example, about resveratrol thinning the lining. They talk about NAC thinning the lining, but I think the anti-endo benefits are so strong that it's beneficial. Same thing for PCOS patients, because those are both good. I mean, we continue it once we started. I haven't had any trouble.
Amazing. What a question. I'm always surprised sometimes. Reading this is always a surprise to me. Hey, Mr. T. Hey. How long do you stay on prednisone, tacrolimus, and progesterone with an FET?
Well, progesterone we keep on for the whole pregnancy. We do the shots till 12 weeks gestation, and then we cut the vaginal dose in half and wait till 36. Steroids depends on the patient, but we normally go till 12 weeks. Tacrolimus, we only recommend for 1 month, but our patients are all panicked. So most of them these days are insisting that they stay on it till 12 weeks. So we let them go if they want to.
I just have to say that I will forever be grateful to Dr. Victory and his team. Without them, I would not be looking at my 3 beautiful children. Thank you, Dr. Victory. Hope you haven't forgotten me. This is Miss DD.
Oh, thank you. That's very sweet. And no, I haven't forgotten you.
What do you think about Zymo? Is the sex rate high on it?
According to Zymo, yes. According to the majority of the studies, there is no benefit to doing microfluidics. We use it for sperm selection for our IVF and sometimes for our IUI because it can reduce DNA fragmentation. So there may be a benefit in reducing miscarriage rates, but there's no proven benefits. Like all the studies, except for I think 1, have shown no significant outcome benefit. So I'm not like pushing it on people.
Miscarriage 3 years ago. My period has never been the same. 2 days now with light flow.
It depends on what happened to you after your miscarriage. Retained products, infection, DNC. Did they scrape too much? Did you end up with Asherman syndrome? I'd have to see you to figure it out. What time is it, by the way? I've lost all track.
54.
Oh, wow. Cool.
Flew by.
Yeah.
Oh. A familiar question that I haven't seen in a while. Dr. Victory, in all seriousness, no joking around.
Okay.
What is your opinion on the Receptiva test?
Look, I like, I think it's Bruce Lessey who developed the test. He's a really nice guy. And he believes that endo matters. So thank God for that. But the test, in my opinion, is useless. So I don't do it. And that's an opinion born of data. There's no proof that it improves outcomes. So I'm not a believer.
Is kefir safe to drink while pregnant?
Kefir?
However you pronounce that thing.
Probably not.
The probiotics are bad for it, you think? Too much probiotics?
Well, it's like fermented milk.
Yeah, I know what it is.
Oh, I don't know about that. Yeah. I don't know. That's a naturopath
It's
question.
a gut health issue.
Yeah, that's a naturopath question. I'm not a gut healthologist or a kefir enthusiast. I've never tried it. Have you?
Absolutely, I've tried it.
Really? Oh, horrible.
I couldn't swallow it. Like
It's
I swallowed
like sour milk, right?
Nothing like Levin or Iron or any of these milk yogurty drinks. Nothing like that. Whole different funk of taste. Whole different funk of that. Like I thought, how different could it be from the what could it be?
Not good.
Not good. Not good.
Yeah.
It's one of those things that you take really for the health benefit, I feel.
Yeah, no.
Because it talks about probiotics, all that jazz. So like you gotta like it's not like okay, it's healthy and tasty. To me, it's just healthy and not very tasty at all.
Have you heard all these stories about people drinking unpasteurized milk because the influencers are promoting that now?
I know people that go to the farm up in someplace and they buy milk
unpasteurized.
right out of the
cow's udder.
Cow's udder. I was going to say cow's nipple.
Yeah, all sorts of people are dying now.
Really?
Including kids. Some mom gave it to their kid and the kid died.
Oh, no way.
Yeah, because it's chock full of bacteria.
Yeah.
And it's unpasteurized. These lunatics don't know what they're doing. It's insane. Oh, the amount of damage being done by uneducated people on social media who think that they have something to offer, but actually have no idea what they're doing. Like I want them liable. That's my thing. Right?
Should be.
Like if you're on social media and you're promoting something that isn't true, I want them liable. Like if you're on there saying vitamin K is bad, I want you liable for every baby
that has any kind of injury from a vitamin K dependent bleed. If you're saying vaccines are bad and like some family doesn't do it and they end up with measles and the kid gets harmed, I want those people, like all of them, I want them all fined. I do.
It's not a horrible
And
idea.
and you know what? And then people go, well, like, are you willing to take that risk? I absolutely am. You know what? If some baby is harmed by vitamin K, feel free to blame me. Because up till now, out of 6 billion doses, not one single baby has been harmed.
Numbers don't lie. Numbers don't lie.
One lunatic told me, I think it was day before yesterday, that vitamin K had been around for a relatively short period of time. I'm like, it's been around for 60 years and it's being used in 6 billion cases. What's your definition of like a short? He goes, well, like I meant relative to humanity. I'm like, do you realize that the majority of people didn't make it past like 50 years of age, even 100 years ago? And that the majority of the reason that the age was so low, the average, was because most of them were dying when they were babies.
Oh,
like people just don't understand what they're talking about. They're just making stuff up because it's all fed to them on social
it's a
media.
good feat. It's a good feat. They're having a great time with it. I'm telling you. 8:59.
There's more fantasy on social
Oh,
media
100%.
health influencers than
100%.
on OnlyFans.
Order of the day.
Yeah, there literally is. Like, there are more people spewing nonsense that's fantasy on social media than like all the fantasy novels and porn that's available. Yeah, it's insane.
That will be a great way to end it. But I do have some questions I want to ask.
Okay.
So the one individual was following up with us. She was the one girl or lady or individual that said, because you were with it 26 weeks, 2 episodes when I was sitting hunched over.
Yeah.
So she follows up. She gave her update. Follow up. ALT was 50. Rest of liver panel normal. OB referred to GI, but GI isn't concerned. Glucose test normal. Blood pressure low. 105/65. No swelling. Going to repeat liver enzymes and get US. But ultrasound, but everything normal besides the ALT.
You need an ultrasound to make sure you don't have fatty liver disease or gallstones or pancreatic stones. You also should be checked for cholestasis, and you should get a like an infectious disease panel check for hepatitis, CMV, stuff like that.
The Bite Me mug is very accurate for tonight.
Yeah, it is very accurate for tonight. To all those of you that told me that I should lose my license for not doing what every single patient wants of me, no matter what I feel about it, I toast you.
Doctors, thank you for doing this show. I watch every week and learn a lot.
Well, thank you for watching. Time to end the show. I would like to congratulate my middle son, Nassim Alexei Victory, who started law school today. Big round of applause. Good job, son. I love you. I'm very, very proud of you. My oldest, who went back to New York, who's a very successful lawyer already and doing great things. Poor kid hasn't slept in like 3 years now, but he's doing great things. And my munchkin of a daughter who tells me hilarious stories every day from medical school in Scotland. And my amazing wife who raised all these kids because I was too busy working. Honey, I love you. You're the best ever. Huge thanks to my team, including the wonderful Tarek Ibrahim and everyone else at VRC who are doing great things and making dreams come true every day in ever more successful ways. And we will be in touch soon with more exciting info for all those of you out there. And thanks to my kids' friends, because they all apparently watch the show.
Who wouldn't watch this show? That's what I want to know.
I think that's kind of cool. Thank you all. If you have time and an inclination, please jump on the more controversial messages, including the one I have on Paging Dr. Fran, where they want to force me to do procedures like I'm some sort of robot or soulless idiot. And anything on vitamin K where people keep spewing nonsense. We're going to have some exciting podcasts coming up too.
with some colleagues, with some people that are great scientists talking about vaccines, autism, vitamin K, false associations. We're going to steer clear of politics, but we're going to talk about all sorts of other stuff. So very excited for the future of our show. We'll talk soon. See you next week, Tuesday night, 8 o'clock Eastern Standard Time on Fertility Factor.